All right, we're going to go over how to place your PPE and our hand washing technique. So you will already have your mask on, so then you will put your gown on first. You'll make sure to have on your tray your glasses, gloves, and your gown. So your mask is already on. You'll go ahead and tie your gown behind your neck and your back. It doesn't matter which one you do first. With this, you want to make sure with your hair it's tied up and out of the way. You don't want your hair to hang over your shoulder or get in the way when you're doing a procedure. So you want to make sure that's secured. As well as you don't want to have any dangling earrings that would get in the way of your mask. Not having any rings or watches, any smart watches, bracelets, anything like that that can get contaminated and harbor bacteria. So now that our gown is on, we're going to go ahead and put our safety glasses over our mask. And then now we're going to step on our foot pedal and go ahead and wet your hands all the way up past your wrist. And then you'll just take a few pumps of soap here. And you want to really make sure you scrub the palms of your hands, the backs of your hands, up and over your wrist. You'll take the opposite hand and do more of like a circular rotary type motion to get up and around because your glove comes up around your wrist. You want to get the cuticles of each hand. And then also to get the under your fingernails, you'll scrub them in a circular motion on the opposite palm. So you do that on both sides and make sure you get in between your fingers as well. Once you have all that done, you can go ahead and rinse. And then after you've rinsed everything, you'll grab a few paper towels. You also want to make sure you don't have any false fingernails, artificial fingernails, nail polish. All of those can harbor bacteria. So you want to make sure that you don't wear anything like that. And this is key to dry your hands really, really well. Take a few extra seconds to make sure you get between every finger. Otherwise, it'll make it very challenging to get your gloves to go on easily. And then you'll also make sure to wipe the counter after you wash to make sure that you've got any water that's splattered. You'll take one more new paper towel and pull the cuff of your gown down to your wrist on each side. And then now we go ahead and get one of our gloves. So make sure you hold the glove with the thumb side up and your hand will kind of be sideways. And you're gonna just pull that on and pull the edge of the cuff over the cuff of your sleeve. So that way you don't have any skin exposed for when you're sitting chairside for a procedure. And then you'll go ahead and do the same thing with the other side. If your hands are damp or wet or any kind of moisture, it'll make it very challenging. So you'll want to make sure they're really dry. And the same thing, pull it up and over the cuff of the gown. And then finally, you want to interlace your fingers. Make sure it's seated down the way and you don't have any gaps at the fingertips. Make sure there's no rips, tears, anything like that. And then now you would be ready to go sit chairside. All right, now we're gonna walk through the process to take and remove our PPE. Say after the procedure's over, the patient's done. So first thing you're gonna do is remove our glove. So what you're gonna do is pinch the outside of one glove and just pull it down your hand, turning it inside out, and then you'll grasp it with the opposite hand in the palm of your hand. And then you'll take your finger and go under to not touch the outside, under and pull that down and around, turn it inside out, and then you just toss that in your garbage. Next, you take your glasses off, set them on your tray, and then you'll go ahead and take your gown off as well. Keep your mask on. You may change your mask between patients, but right now we're keeping our mask on all the time. So you'll untie your gown, turn it inside out, just in case there's any splatter or anything from the procedure and you don't get it on your clothes. Turn it inside out, and you may use it for another patient, or you can roll it up and set it on your tray. In an office, they would probably have a laundry hamper you would put used gowns in. Now we're gonna go ahead and take our glasses and just rinse those and wash them. In case there's any debris or any splatter, we're gonna wash those first. Just take some soap and just scrub the outside. And then we can rinse those off. And then you would get just a paper towel and set those off to the side to air dry. Once you do that, we're gonna do our final wash. Same method as before. Go wet both hands up to the wrist. A few pumps of soap, and you're gonna do the same technique as far as washing the palms of your hands, the back of your hands, the wrist in the circular rotary motion, cuticles, your fingernails in the palm of the opposite hand, cuticles. There we go. And you would just rinse really well. After you're rinsed, you'll dry really well, and then you would be ready to dismiss and walk your patient to the reception area. And that is how you place and remove your PPE for patient care.